No, that was the one I told you yesterday morning.
Okay,
I just
good. Okay.
was swamped yesterday and never got all the way through writing my update for yesterday, so that kind of rolled over to today.
I said this saw the secret, the bold move of approving Sedgwick.
Yeah, went out on a limb there, right? Did they go any further northeast and go out on that limb?
Cameras are live.
Going live.
Did I miss something? Are we supposed to be wearing masks or what?
Just Dwayne asked for it.
Oh. Since I didn't know anything about it.
Yeah. You want mine?
No.
Okay. Okay, we are? Okay.
And Chris is not wearing both. There's both. Do you need a mask?
I have one, but I didn't know we were wearing them.
Yeah.
I guess I can get one.
Yeah.
It's not my nature to fly like that.
I know. Hey, Alrighty, it's 12 noon. Call this Board of Health meeting to order. We could do a brief Pledge of Allegiance before we call roll. If you could join me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Hey, Amanda, could you call the roll, please? Here.
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 Alrighty, and with his back to the camera, but that's okay. Dwayne Smith, our Public Health Administrator. Yeah, today's meeting, really the main purpose of today's is just discuss the status of the county waiver and potential submission or status of other waiver requests that we have pending, and then kind of what our strategy is, whether to hold pending receipt of county approval to make those decisions or to submit simultaneously. So, yeah. Dwayne, if you could.
Thank you, Commissioner. Good afternoon, everyone. Good afternoon, citizens and staff. I want to give a quick update on where the state lies as of numbers reported last night. Currently, there are 20,157 cases that have been identified since the inception of the epidemic. Currently, there are 3,600, or to date, I should say, there are 3,695 folks that have been hospitalized for an infection. 60 counties have been affected. Over 109,000 people have been tested. Sadly, there have been 1,009 deaths, and we want to pause to make sure that we recognize each one of those deaths was a person and not a statistic, and that they had families and loved ones that mourn their loss. There have been 199 outbreaks in skilled nursing facilities throughout the state. Locally here in Elbert County, overnight we reported one new case of a confirmed COVID-19 infection. Our confirmed cases to date now totals 44. And that is since approximately March 16th. We have averaged less than one case per day throughout the length of the epidemic in Elbert County, or in Colorado. Please understand that this figure of 44 does not represent the number of active cases. For folks listening, and we can post this on social media later on, for a look at statewide surveillance of cases, including a variety of very informative metrics that are updated daily. That can be found at covid19.colorado.gov/data/case-data. Some important milestones were reported overnight. As of yesterday, the statewide daily growth rate is down to 0.9%. That's 0.9%. This is the first time the daily growth rate in cases has been below a 1% growth rate. Daily hospitalizations are back down to 0.1% growth. And also of note, Colorado hit a daily testing record last week of 4,500 tests completed in one day. So that's significant progress. The state continues to make significant progress in terms of offering testing. I do want to point out that last week, through a partnership with Peak Vista Community Health Center at the Kiowa location, we began offering COVID-19 testing to local folks. I encourage anyone that is experiencing symptoms of COVID-19 to give Peak Vista a call and have a conversation with them to determine if their symptoms warrant coming in for a test. Currently, CDC protocol dictates that only those individuals that are actively or experiencing active symptoms of COVID-19 are being tested. However, there are plans both at a national and statewide level to eventually transition to asymptomatic testing of individuals. Peak Vista can be reached at 720-389-9763, 389-9763. They are open Tuesday through Friday from 8 a.m. to 5 p.m. You do not need to be a Peak Vista client. They can enroll you as a client in about 5 minutes. The test takes a minute or two. It is the nasopharyngeal test that is still the gold standard for identifying whether or not someone has an active infection. My understanding this morning, information was shared that since we've started, or since they've offered that at Peak Vista, there have been 11 tests completed. The state is still working on ramping up opportunities for Coloradans to get tested. Currently, we are or the Elbert County testing location at Peak Vista is one of about 50 testing locations statewide. Governor Polis has indicated a desire to have at least one testing location in every county. Thinking about testing volume, again, encouraging folks, if they are experiencing symptoms, to get tested. We need a critical, a statistically significant number of tests to be completed among Elbert County residents so that we can have the information and the data that we need to best inform decisions on a local level going forward. Also, if folks are feeling sick, the Colorado Medicaid Medical Advice or Nurse Line, they can call that line at 1-800-283-3221, 283-3221. 3221. That is for any sickness. So we want folks to have that information available. And lastly, anyone who is in need of mental health counseling services or just needs to talk to someone, Colorado Crisis Services is available 24/7, 365. People can call 844-493-TALK. That's 844-493-8255 on the keypad, or they can text TALK to 38255. We understand the significant challenges that people are experiencing and have been experiencing for some time, initially through the stay-at-home order, now as we have transitioned into the safer-at-home order. So we want to make sure folks are availing themselves of all healthcare resources, both physical and mental, behavioral, so that they can make decisions in their best interests about their health. I'll transition to an update on the Safer at Home waiver request that Elbert County has submitted to the Colorado Department of Public Health and Environment. That request was submitted last Monday, and forgive me, the date of last Monday was...
It was the 4th.
The 4th. Thank you, Commissioner. On Friday, the 8th of May, on Thursday, the 7th of May, I received a call from one of the initial reviewers of the request, an administrator at CDPHE, who shared that our request for a partial waiver of the Safer at Home orders did not have an attestation from a local hospital stating that an uptick in the number of COVID-19 cases among Elbert County residents would not place an undue burden on that hospital in their ability to provide patient care services, not only for COVID infections, but for every other healthcare service that's provided by a hospital. Certainly I pointed out that we don't have a hospital in Elbert County, nor do we have a freestanding emergency department or urgent care or anything like that. We were guided to identify a hospital outside our county that serves as one of the main acute care providers. We solicited data from Elizabeth Fire Rescue and Rattlesnake Fire Rescue and asked them, where are you transporting the majority of your patients for all emergent transport services? And I believe Elizabeth stated that about 72% of their cases go to Parker Adventist Hospital, and I think Rattlesnake was around about 75% of their transports go to Parker Adventist. So overwhelmingly, when Elbert County residents need emergency care, they are taken to Parker Adventist. So I reached out to the executive leadership at Parker Adventist, submitted a request for that attestation that an uptick would not unduly burden their hospital or their resources. They very quickly turned that around and provided us with that requested letter yesterday morning. I want to take a moment to thank Parker Adventist Hospital and Centura, their corporate leadership and their corporate counsel, for getting that in such a timely manner, getting that back to us. That letter was subsequently added electronically to our request for a waiver to CDPHE in the electronic DocuSign platform, and presumably we are back in the queue with regard to that request being reviewed. As I understand it currently, all our ducks are in a row with the paperwork and is moving on to the next step in the process. To date, many counties, and I'm not sure, but perhaps some municipalities have requested a waiver to CDPHE. To date, only Eagle County, Mesa County, and just yesterday, Sedgwick County has been granted a waiver by CDPHE. Yesterday, in a call with CDPHE Executive Director Jill Hunsaker-Ryan, it was noted that CDPHE is being very judicious with which counties are granted waivers, and those with regular COVID-19 outbreaks are unlikely to be granted. The possibility also exists that should there be a recent increase in cases, a period of additional monitoring may be requested before a decision on an application is made. Due to the current volume of requests from around the state, CDPHE also shared that the turnaround time on a decision is currently 4 to 5 business days. So what does that mean for Elbert County's application? My best guess is that as it goes through the review process, and certainly they are going over the documents with a fine-tooth comb, the possibility exists that they may reply to us and say, we'd like a little bit more information. We'd like to monitor the situation for a period of time. And that, in my conversations with fellow public health administrators around the state, that is not an uncommon request that CDPHE has been making. So we will respond accordingly to any question that they have in as timely a manner as we can get that answer to them, and certainly continue to keep everyone abreast of developments as that request makes its way through the process. Where that's especially important in the coming weeks is obviously for high school graduations, but also for activities like houses of worship and allowing them to have congregants attend services or mass beyond the current limit of 10 people as stated in the Safer at Home executive order and the second amended Safer at Home public health order. We are monitoring how other counties are responding while they await a decision from CDPHE, and we'll keep everyone abreast of that. Thinking about or sharing an update on the timeline for decision making. Yesterday, Governor Polis, in his remarks, shared a timeline for deciding if the state can further relax restrictions on the state's economy and on our society. Remember that we are currently in the Safer at Home phase. I anticipate that the state will remain in a Safer at Home phase for several months to come. The understanding that I have from conversations is that the next phase, which will be called Protect Your Neighbor, may not come until this fall or perhaps later. We don't know what we don't know in terms of how transmission of the virus will respond in various counties as we ease restrictions.
Well, and if we don't ever ease restrictions, we'll never know. So.
Understood and agreed. The state, Governor Polis mentioned that the state takes into consideration a number of factors in the decision-making process, including what level of suppression of the virus that we've been able to achieve, what's our ability to do testing and containment, will the decision put vulnerable populations at significantly greater risk, does our healthcare system have the capacity to handle a surge, is the policy sustainable? And perhaps most importantly, what's the level of risk versus societal and economic and psychological reward? I'll try to answer a couple of those questions. The first one was, what level of suppression of the virus have we been able to achieve in Elbert County? I would say a pretty good suppression. Our continued level of suppression is predominantly dependent upon our citizens and also our visitors, adherence to the social distancing, to doing things like wearing face coverings, washing their hands, not going out if they're sick, limiting their travel across the county, and a variety of other issues. What's our ability to do testing and containment? Again, I mentioned our collaboration with Peak Vista Community Health Center in Kiowa to offer that testing. As far as containment goes, we're still in the discussion phases for how we will establish a more robust contact tracing component to our efforts. In a conversation yesterday, CDPHE shared that some news that they have been in discussions with the Piton Foundation and Gary Community Investments to establish a cadre of tracers that will be assigned to each county. They will be working remotely under the guidance of local public health authorities. In our internal conversation yesterday, we had talked about how that might look from our existing resources or transitioning folks that are already Elbert County employees. One of the challenges with the contact tracing is the training that needs to occur. What was shared yesterday in this announcement was that cadre will be trained and there was no timeline given, but presumably that will happen in the next couple weeks. This is a challenge across all counties in Colorado, not necessarily specific to Elbert County at all. Even some of the larger local public health agencies are significantly challenged with doing the appropriate level of contact tracing. Another question was, will this decision put vulnerable populations at significantly greater risk? That's one of those $64,000 questions. Significantly greater risk? I don't think so. No one knows for sure. That's the most honest answer. I believe as long as folks make reasonable choices on how they balance their level of risk mitigation, their comfort level with risk in going out in the community, and that's speaking beyond the normal necessities of being in the community, going to the grocery store and the pharmacy and doctor's appointments and things like that, as they exercise or go to other smaller gatherings. That is going to be, quite frankly, a trial and error. We will undoubtedly see spikes as restrictions are eased. We'll undoubtedly see spikes in the number of people that test positive for the virus. Our ability to mitigate those hopefully micro increases or small spikes, again, is dependent upon how well we as a larger community protect our neighbors. Is the policy sustainable? Quite frankly, it's going to have to be at some point, right? We have taken thus far a very soft approach when we've been notified of businesses perhaps not adhering to social distancing requirements as per the executive order and the public health order, and just paying them a quick visit to ask if there's anything we can assist with, or making a phone call. We do encourage folks, if they are seeing issues that concern them with regard to public health orders, to please call us and let us know. If we don't know about those, we can't follow up and have that conversation with the appropriate businesses or individuals. We also need to figure out how we're going to monitor and evaluate what's working and what's not working. After any decision is made, if there's a safe way to partially loosen the restrictions, the governor shared that he'll announce when the following activities could take effect. For example, restaurants. On May 25th, the state will provide guidance if we can if we can begin phasing in restaurants and at what level. The state is working with stakeholders, both, I believe, at the state, local, and national level, including with the National Restaurant Association, looking at some of their guidelines for risk mitigation in their restaurants. Also on May 25th, we anticipate guidance on whether or not summer residency camps and day camps can resume in June and beyond, and if so, under what conditions. After June 1st, the state will modify the Safer at Home order a little bit further to phase in other summer activities and in public spaces such as libraries. The governor indicated he'll make these decisions on a rolling basis based on the latest data and evidence. It'll be similar to efforts where the state has strived to provide an accurate picture for May, back, if you think previously, towards the end of April. In other words, the decisions we make today, or the decisions that are, or the guidance that's handed down on May 25th, will influence where the numbers are at the end of June. So I tend to think of it in kind of a rolling 4-week period. We may find out, not putting a timeline on it, but let's just use May 25th, for example, or sometime at the end of May or early June, the easing of the maximum gathering of 10 may be eased to 25. And 4 weeks hence, looking at the data, monitoring the data in the interim, that 25 may be eased to 50 to 75. Whatever the numbers indicate is the safest approach to that. No one can know in advance what the actual decisions are going to be. If we do a good job keeping our distance, staying at home, wearing masks, facial coverings when we go out, then it will show up in the data. And we'll have more flexibility to remove additional restrictions on movements, on the economy, and other conditions. Conversely, if folks aren't following the Safer at Home order, it will show up in the data. The rate of spread and hospitalizations will begin to tick up, and state leaders may need to hold off on easing restrictions or possibly go in the opposite direction. Obviously, nobody hopes that's going to be the case. Please note that the dates that I mentioned, May 25th, are not potential opening days. These are the days when state leaders believe they have enough data to make a decision. We simply need more time to collect the data on how Coloradans are behaving as a whole to make safer decisions. Continuing on the conversation about restaurants, we are working on guidance to provide to restaurants. I hope to be able to provide that through our environmental health specialist, Stacy Reinhardt. She is the connection to our restaurants for operational considerations that are being discussed over the last couple weeks. Understanding that we're all wrestling with the implementation of rapidly evolving state public health orders. We receive numerous questions on a daily basis on both what the new normal will look like for restaurants and when the normal will start. It's very challenging to say when that new normal will start. I know Governor Polis has commented that he hopes to have restaurants open at some capacity before the month of May is through. So if we're trying to read between the lines, if the guidance is there on May 25th, hopefully there will be guidance that folks or restaurants can open shortly thereafter, given certain restrictions or certain considerations. Some of those considerations might be limiting capacity to ensure that social distancing is maintained. That might possibly be based on a percentage of the fire occupancy load. It may include removing tables or using signage at a table indicating this table is not in use. It's a social distancing table zone. Creating barriers or buffers between and around seating areas is another option. Limiting group sizes. Modifying the menu to create different workflows to engineer social distancing in the kitchens among staff. Requiring reservations for all dine-in services. Not allowing seating or customer walk-up to bars and restaurants. Face coverings required to be worn by staff. Signage on the door telling guests that are experiencing COVID-like symptoms to not enter. They may implement daily health checks or temperature checks for staff. It's probably a foregone conclusion that buffets are on the way out. Those are just harbingers for viruses and bacterias, with the possible exception of a buffet that may be staffed by one of the restaurant employees. For facilities that have been closed for a while, I anticipate there will be additional guidance for those restaurants. Obviously going through all perishable food items and discarding any that were prepared prior to closing or that are out of date, flushing the water lines and the soda lines, doing deep cleaning and disinfecting, reviewing guidelines that have been distributed on whatever the new normal looks like, conducting virtual staff meetings with staff to get connected to the requirements prior to opening. We don't foresee developing or reopening an operational or operationalizing any expansion checklists. In other words, restaurants have a periodic inspection that's required by the state. We're not going to do a re-inspection. We'll continue to conduct normal risk-based inspections, and we'll reinitiate retail food inspection activities. We'll have, like I said, more guidance on this pushed out to local restaurants, hopefully within the week. I will pause there, and that's the crux of what I wanted to share, and can certainly entertain any questions or any other thoughts to discuss.
Yeah, just, Evan, thank you, actually. There a lot of information there. Just doing some quick math as you were rolling through the numbers. I mean, obviously the state's managing to the highest known risk, and that's really all they can do at the state level. You know, we've had, as you said, 44 cases since March 16th. Count back 14 days from today is probably the ones that are still potentially ill and or able to pass the illness on. We're about 0.5% of the state's population. We've got 0.2% of the state's cases. Tragically, we've had one death, but it's 0.1% of the deaths. We've had 0% of the outbreaks. I'd like to see more tests. 11's a good start, but clearly we're ahead of 14 other counties in terms of we've got, if there's only 50 test sites, and I'm sure some of the bigger counties have multiples, so we're probably ahead of more than 14 other counties in that. Question on, the baseline of, is Peak Vista testing anybody who walks in, or are they testing people that are symptomatic or have had some indication that they should be tested because they may be ill, because I'm not sure how that, I mean, the baseline testing, I think everybody's going to struggle with, because unless you get a sampling of some sort of test that can tell you whether you have it or have had it, you know, you don't really have a baseline. You've just got a self-selected group of sick people.
So a couple things there. Current protocols from the Centers for Disease Control and Prevention are that only symptomatic people should be tested. And that is what Peak Vista's following.
Right.
However, in the example of, we've had, I want to say at least 3 instances where a spouse infected another spouse in the home.
Yep.
So someone may not be symptomatic, but one of the screening questions would be, have you been in contact with anyone that has symptoms in your home, place of work, things like that? Do you know anyone that has tested positive? Things like that. So it's still an evolving process. And as I said, we, on a larger scale in the state, want to get to a point where we're have the ability to offer asymptomatic testing. I also want to address a lot of conversations and questions we get about antibody testing and the serologic testing, which is serologic testing is blood serum. So that is not an approved or endorsed mode of testing yet by CDPHE. So we are following their guidance. I have seen at least one testing site in Aurora that is offering the antibody testing, and what I read was in their promotion for the antibody testing, it said it's I want to say it was 90% accurate, but until such time as the FDA and other federal entities, as well as CDPHE, has a comfort level with that, we won't be pursuing that or having those conversations. So.
And I know it's just one of those ones we've talked about multiple times in terms of, you know, we've got 20,000 cases in the state, 100,000 tests. It's still, I mean, early on it was about 16% of those tested were positive. It's crept up to about 20, so I'd assume there's more
and
perhaps asymptomatic people that were in contact that are being tested now and being captured. So, but it's still a pretty low positive rate when the bulk of people being tested are symptomatic. So,
and to give us the data that we need to make local decisions moving forward, one thing that CDPHE is looking for is the percentage of positives from testing. I've heard figures, it started out probably somewhere around 10%. They didn't want to see any more than 10% of everybody that got tested coming up positive. That has been reduced gradually. Ideally, it's below 5% now, and I've heard lower percentages kicked around. So here's where it's important that we ramp up the number of folks that get tested. So we need to know good, bad, or indifferent, and we'll respond to each scenario. Given our numbers, again, if you look at the 44 and kind of subtract those in the same household, off the top of my head, I would say as far as individual household infections, 35, 36, 37, somewhere in there, which again is pretty good.
Yeah.
So,
it's like I said, it's just, I think what we all continue to struggle with is, you know, we want to see a lot of tests that show a baseline, but we're still only testing those that are positive. You clearly are very likely to be positive, so it's a skewed testing regimen, regardless.
Imperfect.
But and not it's just what we're dealing with. There's something else in there that. For the Peak Vista, and I know there's certainly the HIPAA considerations, but do we have the ability, like if somebody when Cedars comes in, do we get the test site or just the lab site? So, and are we able to track to see if of those 11, I mean, if they've taken 11 tests, I don't know over when they took them, when the results come back. You know, certainly we haven't had 11 positives since they started testing. So obviously, you
No,
know,
we've not had 11
but we probably
positives.
haven't gotten all those results back
Yeah.
yet. So can we track at least with that small population, and it's going to grow obviously over time, what the percentage rate that we know are being tested of our own citizens?
Yep, good question. So yes, we have the ability to look in Cedars and identify where they were tested.
Yeah.
I just heard the 11 this morning.
Yeah.
So I have asked Stacy Reinhardt, our environmental health specialist, to, as she reports out every morning from the Cedars overnight results, if we have a positive test, to also report where that person was tested, so that we can put a finer point on the efficacy of the
'cause-
Peak Vista testing.
Yeah. It's clearly everybody tested up prior to was tested outside the county, and I think even the one lab test that, I mean, the test that our OEM director took, I think went to a lab in Texas, so who knows if that one negative is captured anywhere
Yeah, and I
as a tested Coloradan. So not that one's going to skew anything, obviously, but
And Peak Vista is, for those folks that test positive, they are providing the follow-up and issuing the isolation orders and, reconnecting with them to check on them throughout as the virus runs its course. So,
you guys have any questions or anything on just the data type piece? And if we could talk waivers a bit. Again, I'd kind of like to see, if you guys agree, if the state comes back with a question, that we try to answer it within 24 hours, if at all possible, because I don't know if, 4 to 5 days, we're well beyond that. We're well beyond that for, there were, I think, 15 it's the 2 waivers that were approved before there was a waiver process. So the one that has been approved has had no cases, but that leaves about 14 other counties. And, we've had the one request for a letter from a hospital, but they said at that time they'd continue processing it, absent the letters, and add that as an item once received. So they've had much more than 4 to 5 days with ours without any questions. So I like to be hopeful, but it doesn't look like they're making 4 to 5 days. If they've had no other questions and did continue to process, then that letter yesterday should have been the last thing they needed to look at, or they need to ask another question, or they need to provide some guidance, and we can ask back through CCI to get a broader look, but at what's going on countywide. But on the individual waivers, again, I think this certainly for all of us here, would really like to get those submitted. In my mind, there's two positives. If by the end of the day we get a waiver approved for the county, we can withdraw them and act on them locally. But submitting them shows the thought process we go through for an individual waiver, and that might be helpful for those that are looking at our broader waiver to say, how does Elbert County handle these requests?
if I can add something
Yeah.
there, Commissioner, with regard to houses of worship, so we have a Catholic church in Kiowa that has done an excellent job, Our Lady of the Visitation, with their approach to offering services to parishioners. They are part of the Archdiocese of Colorado Springs. The Archdiocese of Colorado Springs had provided some initial guidance on how in-person worship services could resume. Our Lady of the Visitation went several steps beyond that. yesterday in a call with faith leaders, over 700, with Governor Polis. He indicated that if the house of worship, if the facility, if the structure allows for it, obviously adhering to social distancing and encouraging parishioners to have masks and things like that. Some larger churches or sanctuaries may have multiple areas where they can accommodate 10 people at a time. So let's say, for example, the main sanctuary has 10 worshipers, social distance, and then they have something in an annex or a fellowship hall or something like that. So that was a realization that was a little bit of a change. So we want to make sure that folks understand that. And I also want to...
So currently, the strict reading is just no more than 10 people in a facility with social distancing at any time. Okay. And I mean, am I correct in that, or and I'm not saying that that is the guidance, or that's the order that was given.
Paraphrasing, but with accuracy in what Governor Polis said.
Yes.
If you have 4 walls and a door in a separate area of the church, that's an additional 10 people, in addition to, let's say, 10 people in the main sanctuary.
Yeah.
With air quotes, 4 walls and a door. And obviously,
I don't want to make light of
process.
it, but that. How do you explain Walmart in that scenario? I mean, and I'm not. That was rhetorical, I guess. I'm not going to ask you to try to explain the state's decision making, but okay. But the waiver you'd prepared on that, I mean, personally, I support and pushing it through, not as doing it on our own. I don't think there's any. I think there's great risk if we just say that it makes 100% sense to go to 25 absent, regardless of what the state says, while at the same time asking the state to give us approval to make that decision. So I'd think that, along with the smaller high school waivers that were prepared, just need to go forward. And if the state denies our county waiver, then we've got to regroup and sit. If they rule on those prior to a county waiver, then we, ideally positively, then we go forward. If we wait and get a denial, or the longer we wait, the more waivers are sitting in that queue. And I know there's 15 countywide ones. I can't imagine. I mean, there's 178 school districts, so I'd assume there's somewhere around 178 high
and I
school
think it's
waivers
important.
sitting out there, plus whatever events and others are out. So I know they've got to be overwhelmed, but
And I think it's important to note that we're not, with these waivers, and as the easing of restrictions comes about in the days and months to come, we're still going to have checks and balances in place.
Yes. Yeah.
With the school, with the church, whatever. And in the case of the Catholic Church yesterday, I went out there and I wanted, for my own understanding, to see the layout, the plans, and things like that. So there will most assuredly be some type of site visit, for lack of a better term, for each situation. And I think our goal through all this is to have the flexibility to make decisions dependent upon individual circumstances.
And I know, just having seen kind of the eruption of comments on social media, that not a lot of people actually read what the county waiver requested, but it was exactly that. If granted, the baseline remains the state orders, and then based on local data, local knowledge of the specific business or event, you can make a rational decision on how to do something, to be able to do something safely that doesn't indicate any, you know, I mean, everything's a potential risk every day, but that there's no, it was not and is not a request just to say exempt Elbert County from everything and go about life as it was 3 months ago.
And many
and
of
I
the
think that's a
requests that we get
misunderstanding.
are not decisions that we can make
Right.
as the health department.
Right.
Some of them are school decisions
That's right.
that have a health component, but ultimately they are a school decision if they're taking place on school property or a school endorsed function or something like that. So in those instances, we've been deferring back to the school.
Yeah, no, and I think that's the right thing. I mean, we can provide expertise and information, and right now we don't have the authority granted by the state to do more than I guess interpret their orders through the lens of public health and just inform people. So but in terms of the waiver for houses of worship and this, I think you're still working with Elizabeth to develop a plan that,
Yeah, we need to connect with
or we're also waiting to see what El Paso's
the
waivers might
local
look like.
fire rescue services. In this
Yeah.
case, I think this would be in Kiowa's district.
Okay.
So, but as those, geographic requests come in, we want to be inclusive, make sure on a smaller level that should anything happen, that we're not creating additional burden to emergency personnel
Yeah.
and other support services.
And I know you didn't address it here, but I mean, we're balancing a lot. I mean, I know you're balancing a lot. I guess the sheriff had reported over the, March, April period last year to this year, there's a 13% increase in domestic violence and suicide calls for service. So, I mean, there's a lot of this. I know this is consuming 99% of your time, but there's still certainly other public health
That's right.
components that we're looking at.
The other components didn't
countywide.
stop.
Yeah.
Yep.
So, I guess if you guys don't have anything, I would just say based on this, and just submit those waivers. The smaller waivers we have waiting, so they're in the hopper regardless of what the state says. And then any assistance you need, if there's a question that comes back, to turn that as rapidly as possible. I guess the other ask I would have is just, is there value in, I mean, we have a pretty robust retiree population in the county. A lot of them are, there are a lot of retired nurses and others that, understand HIPAA, understand those requirements, that may either be available either for hourly contract or volunteer their time to do some tracing if, to get the ball rolling on that.
Yeah.
'Cause the more we know about.
Once we get guidance from CDPHE on how that's going to roll out and the necessary training, and I don't know, to the best of my knowledge, I haven't seen any local documents, so we've still been working off the CDC case report, which is an abbreviated contact tracing document.
Okay, yeah.
So once we get that guidance, we'll certainly proceed as quickly as we can. But to your point, any retired health professionals, semi-retired, or volunteers that have experience, nursing, coding, anything like that, and knowledge of HIPAA, please connect with me.
Okay.
We need all the help we can get.
Yeah, no, I appreciate that, because I'd imagine the state's operating above their capacity too. So
Most assuredly.
their ability to come up with a plan that we depend on in order to meet their requirements is, we're getting potentially in a chicken and egg thing. So I think the more capability we can build ahead of time, even if it's with local guidance and training that we augment as it becomes available, I think the better. I mean, we'll continue to see the hope, you know, ideally 1 or 2 cases every couple of days. But if we hit a point where we want to go backwards to get a better view of what occurred, you know, it's just, you know, it's more work to go back and do. I know I personally would just like to have a little clarity on, you know, our previous cases. Were they essential workers that were leaving the county? If we know they were, I mean, we haven't seen anything that clear. I mean, we have that funnel of Safeway and Walmart in the county that everybody, or at least a person in each household, has likely been in many times over the last month, but no clear no indication that